We all know that anxiety can really affect a person's life, and if left untreated, it can be debilitating. But there is help available, and that's what we're discussing today with our coastal expert from Horizon Behavioral Health, the new staff psychiatrist with Horizon, Dr. Manuel Mota Castillo joins us. Hi, Dr. Mota, it's great to see you.
Thank you.
All the way from New Mexico. You were chief psychiatrist in New Mexico, and now here in Savannah. Welcome to the area.
Thank you. It's a pleasure to be here.
So let's jump right in. I mean, for some of our viewers who may not be familiar with anxiety, maybe it's something that they feel, but what exactly is anxiety?
Anxiety is what we call nervousness, feeling anxious, feeling antsy. Some people will say that sensation of something bad is going to happen, uncomfortable and impending doom, that can manifest in so many ways. There are many types of anxiety. Anxiety per se is not technically a disease, it's a symptom, because then you have the other type of conditions that include anxiety, like post-traumatic stress disorder, obsessive compulsive disorder, panic disorder, social anxiety disorder, and then you go into claustrophobia, agoraphobia, and so forth.
So, Dr. Mota, let me ask you this. Can anxiety actually be cured?
Yes. It's one of the very few conditions in psychiatry that can be cured, because many, like bipolar, schizophrenia, you can keep it under control, but they never go away. The anxiety disorder actually can be cured.
So what are some effective treatments for anxiety?
Well, there is only one.
There's only one?
There is only one. It's called cognitive behavioral therapy.
Cognitive behavioral therapy.
Therapy.
Okay, so you're going to have to tell me what that is.
Well, it's based on the idea that we feel the way that we think.
Okay.
You know, and if you can change your thinking, you can change the way that you feel. So it is a specialized type of therapy. It's not like the traditional couch therapy, where you lay down and talk about your life. It's more like doing homework.
Okay, so it's and does this have something to do with not letting you train your mind, not letting it take control of you, like you don't let your mind run away from you?
That's the right word, train. You are trained. Let's say that you are involved in a serious car accident, and after that you can drive. And just the idea of driving, just thinking of driving, get you sweaty and anxious, heart palpitations, completely agitated, and has to think of something else. So with what they call exposure prevention, you little by little, with the help of your therapist, you start to think of the idea of driving, and you go through the process of getting nervous, getting excited, afraid, and you keep thinking for days or weeks, for how long it takes. It varies from one person to the other. And when you feel comfortable with that, then you go to the next step. You go and sit in the car. Just sit in the car. Don't turn it off, don't do anything, and you get nervous again, and then the next step is turning on the car.
Oh wow, so it really is training. You go through a training process.
It's a training.
So I know Horizon's Behavioral Health, you guys really are the experts when it comes to learning to cope with anxiety. Let me ask you this though, what about medications? Is it always necessary to take medications, or Are there medications to treat anxiety?
Yes, there are medications very effective, and actually it is recommended that you start with medications because the cognitive behavioral therapy takes for a long time.
Takes a time.
And you don't want to have this suffering for that long.
So the medication can help cope with the symptoms right off
Yeah.
until you are able to go through the training to be able to train your own mind to do the right thing and to cope with the anxiety.
Correct. And once you complete your training, you don't have to take medication. That's the beauty of that.
Dr. Mota, anxiety can affect anyone. What happens if anxiety is not treated?
It gets worse. It has a snowball effect. And this is something that I recommend and tell, especially people with obsessive compulsive disorder or social anxiety disorder. If you are afraid of being in a group of 10 people today, in 2 or 3 years you are going to be afraid of being in a group of 3.
And we all know that the experts are right at Horizon Behavioral Health. Dr. Mota, I want to thank you for joining us today and for all the information that you provided us on coping with anxiety. It's great to see you.
My pleasure. Thank you.
If you'd like more information on Horizon Behavioral Health and learning how to cope with anxiety, or any of our coastal experts, just go to our Coastal Experts page at wsav.com.